Hey everyone, Dr. Alibhai here. We're going to teach you a glute release point with the lacrosse ball. This is really important. Obviously, our bum muscles can get really tight, trapping and irritating nerves, but also changes the way that we walk and move, can cause knee problems as well, lower back and hip problems too. So the areas that we're going to be targeting are right. So if you look at the pocket region here, you'll feel the bony prominence. That's your hip, the front of your hip bone, the femur. And you can go on either side of it. We're going to go behind it on the glute min, glute medius, glute max muscles. So they sit right in this region here. I don't want you going right in the middle of your bum because that's where your sciatic nerve comes out. But we're going to spend more time here releasing some of the tissue that can become really gummed up over time and painful. So the first thing you're going to be doing is laying on your side on the ball, and you're going to be finding the tender point, and it's gonna hurt. It should be a 4 or 5 out of 10. You can lay on the ground in whatever comfortable position you are able to get in. And what I like to do is use motion so that the tissue can slide and glide. If you're just pushing into the tissue, it's hard to get the effect that we're looking for. So let's get an appropriate dose response. So push in on that hard spot, and you're gonna bring your leg so it's not straightened out, but it's still bent, but it's nice and parallel to the other leg, so your hips are nice and lined up. And then you're gonna bring your knee forward up towards your chest. And what you're really doing is getting that muscle to move in motion. And it's kind of like a wheel. And you're just finding some spots that, okay, it's a little tight in that range right there. I'm gonna actually push into the ball a little further. Breathe out, let my body sink into it. Good. I'm going to find another range right there. Now I've kind of run out of tender points, so I'm going to kind of shimmy onto the ball a little bit. I'm going to get right behind the hip bone where some of those tendons insert, and those are tender. And I'm going to start down at the bottom here, and I'm going to bring this knee up. There's another spot. I'm going to push my leg, my hip into the ground, into the ball, contract into it, and then breathe out and relax the body. Good. Okay. So for me, even up at this top range here, I find that quite tender. So I'm going to spend some time there. Breathe out. Good. Experiment with different points in through the hip, and you're really targeting the glute muscles, and you'll notice afterwards it's going to feel a lot better. I would do this before you do any physical activity, even before you go for a walk. That'll make a big difference for you. We'll shoot another video later for you that targets some of these inner fibers here, the TFL attachments, and into the quad as well. Let me know how that goes for you. Try and spend at least 5 minutes on that on both sides. Try and do that daily if we've talked about it, prescribed just for you. Have a great day. Bye now.